Hi, and welcome to our re-recording of our One List Wednesday that we had on COVID updates. We had a couple of technological issues, so we just to make sure that we've got this posted onto YouTube as well. We're just re-recording. I've got some questions here that students have asked, so we'll make sure that we cover some of that information as well. So I'm gonna go ahead and get started. Just a reminder, we're still using a lot of the same prevention strategies that we were using before, such as wearing your mask. Although a lot of us have lovely LU masks, so we want to make sure that we're still wearing those around campus. We also want to make sure that we're still practicing safe social distancing, so staying 6 feet apart. Part of that is if you're going to be within 6 feet, wearing your mask. And also avoiding large crowds if we can. If you can't avoid being in a crowd, say you're in a class or something like that, making sure that you are, again, following the social distancing and the 6-foot rule. And then still making sure that we're washing our hands often and keeping hand sanitizer on us. I like to have hand sanitizer on me at all times, or you can even get the hand wipes as well and kind of keep those on you. So just we're gonna go through some quick reminders on if you are exposed or you have symptoms. The first thing is to make sure that you are staying home. And the only exception to that would be to get medical care. The other piece to that is if you are staying home, maybe you live with people who haven't been exposed yet, making sure that you are isolating from them. The keys to staying at home, and when we tell people to quarantine, is that we're making sure we're stopping the spread. You're not stopping the spread even if you're at home and you have people come over and hang out with them. So making sure that you're also isolating. Taking care of yourself, and this is by staying well rested, so make sure you're getting enough sleep, staying hydrated, make sure that you're eating well as well. Those are all things that can kind of help you recover or help you stay healthy. And then getting care immediately. So if you do, for whatever, have symptoms where you have trouble breathing or pain and pressure in the chest, then we want to actually get some emergency medical attention. And just making sure that if you do seek medical attention, see what maybe their protocols are, if they want you to call ahead before just walking in, making sure we're following all of that. There is a new CDC guideline, and that is an option to reduce quarantine. It actually, what it is if you do not test, you can end quarantine after 10 days. If you do test and you make sure you test day 5 or later, then you can actually end your quarantine at day 7. So that's, I mean, if you get a negative test result on day 5 or later for your test day, then you can actually end your quarantine a week earlier. These are super helpful because it gets a lot of people back to work sooner, which is really great when we talk about, people who a lot of the struggle is they aren't getting paid if they're not working. So this is really useful for them. So we're happy to see that this is the new kind of quarantine guidelines. Making sure that, going back real quick, making sure that if you are quarantining, making sure that you're also following whatever your work, school, whatever policy that they're following. I do know that some people still have the 14-day policy, so make sure you're following that work policy first. So a couple of things that we wanted to talk about, because there are a lot of difficulties that come with the pandemic. And so we want to make sure that we're providing some of the information to you. I touched on the first one is taking care of your body, making sure that you're staying healthy. A lot of that comes to making sure that your body has that nice immune response. So if you do become sick, you can recover quicker or be preventing you from getting sick in the first place. The other thing is to make sure that you're connecting. So one of the Wellness Wednesdays that we're doing is making the most of social connections during the pandemic, and a lot of it touches on being online and resources and some of the difficulties around that. So, this is a topic that we're exploring more and more. So making sure that you're staying connected, whether it is still utilizing in-person options and being socially distanced and safe and wearing your mask, or it is you're taking use of any online opportunities you can. Taking breaks. This goes along with some of that self-care, mental health piece. We've talked about that in the past, but making sure that you're also resting yourself and taking breaks from the constant online technology. So cut the screen time, unplug, turn your phone off, turn your TV off, turn your PC off, do something where you're getting away from the screen time. Staying informed. So making sure that you are paying attention to what information's out there. That's part of the reason that we're doing this presentation, is we can update you on some of those new guidelines. But then on the flip side of that is a lot of the anxiety that comes from dealing with this pandemic is being so in touch with the news and being on social media and seeing all the negative stuff. We want to make sure that you're also taking care of that mental health and making sure we're not excessively checking. And then the last one is asking for help when you need it, or maybe asking other people if they need help. Recognizing that this is a difficult time and a lot of people are dealing with some amped up anxiety and depression. So making sure that we're looking out for ourselves and other people. Some quick updates on testing options. So the Student Health Center does offer a rapid test. It's a convenient location, and since it is a rapid test, you get your results in 15 minutes, which a lot of people are still looking for. Our testing does have a fee attached to it though, so make sure that you're aware of that. Some of you may have a primary care physician that maybe do testing locally. Theirs may still be with a fee though, but that's also an option for you, so make sure you can consult with your primary care physician. And then Lamar is currently doing the free testing. There's the kiosk right over at the Montaigne Center. The website's here. You can go to lamar.edu/COVID testing. This is not sponsored through the Student Health Center. This is something that the university has done independently of the Student Health Center. So don't call us, visit the website if you've got any questions about it, but that is still running through February 18th. So that is something that is available to you and the community as a whole. So this is not just Lamar specific. So if you know a friend or family member, maybe they don't go to Lamar, but they need a free test, this is a location for them as well. So since this is a re-recording, if you have any questions, please drop a comment below, and we will be happy to answer those questions. I'm just looking for the questions so I can answer. So one of the questions that we did have when we did our live session was where we're at with the COVID vaccine. The Lamar Student Health Center has been approved for the COVID vaccine, but we are still waiting for those to become available. We submitted our application, got approved, but we will be updating the campus as a whole as to when our vaccines will be available. So just stay tuned to our social media, the health education side. So that's my department. We try to keep our social media up to date and pretty quickly update with all the information. The Student Health Center for medical counseling does also have their own. So please make sure that you're seeking those out and following those, as well as visiting our Student Health Center website on the lamar.edu website. We keep all that stuff up to date as much as we can. So staying tuned to that because that will be coming hopefully sooner rather than later. We just do not have a specific date or time yet. I had another student ask, will we always be wearing masks and where are we kind of moving to? And I think the best answer to that question is that for the foreseeable future, until the vaccine is widely distributed, and we kind of see where we're at with COVID, and there are some new strains out there. For the foreseeable future, I still see us wearing masks and taking a lot of precautions. So don't think that that's necessarily going away anytime soon. I do think the nice benefit of not necessarily the pandemic, but a lot of this is people are recognizing the healthy practices and recognizing, when they should stay home and take care of their health. So there have been some positives that have come out of this, I think, as we're really putting an emphasis on that. For example, the flu season wasn't necessarily bad this year. And a lot of that comes from a lot of the precautions that we've been taking. A lot of people got their flu vaccines this year, but we were practicing social distancing and wearing masks. So which, flu was spread very similarly to COVID. So I think people did a really good job of mitigating the flu as well as COVID. So just note that those healthy practices, I don't think will go away. I just don't see the masks going away as long as COVID is still a concern. Not just, here locally, but nationally and internationally as well. So like I said, if you've got any questions after watching the recording, please feel free to drop them in the YouTube. I will monitor those and try to get answers to you guys as soon as possible. And just stay tuned. If you have any questions or you'd like to make an appointment with the Student Health Center, please feel free to call our number. It's right here on the slide at 880-8466. And again, my name is Marie Murray. If you've got any questions specific to the health education side, please do not hesitate to ask for me when calling. So I'm going to end the recording here. Thank you so much for watching. And for those of you that joined in the live presentation, I appreciate you as well. Thank you.